I want to start my talk. First, everybody understand what is coronary artery disease, or in layman term, you heard day in day out heart attack. Heart is like a pump in our body, which works for the whole of the body, and at the same time, he also needs nutrition for himself. So there are few vessels on the surface of the heart which provide the oxygenated blood to the heart. These are called the coronary artery diseases. As rightly Dr. Ajay mentioned, when there is a blockages to a significant extent, then there is no blood supply, adequate oxygenated blood supply to the heart muscles. So they start crying in the sense of chest pain, unpleasant feeling, shoulder pain, neck, jaw, epigastric discomfort, and so on. And this is a warning symptom from the nature that your heart is not getting adequate blood supply. So if you go and consult a doctor, then he can investigate you and tell you what's wrong with you. So that is coronary artery disease. This the blood supply, or layman term is a water supply to your home. If there is any blockage in the water supply, you won't get the adequate blood water in your house. So my talk is basically from coronary artery disease, some leading facts. It's a leading cause of death in 21st century. 50% people of the heart attack, they could not reach hospitals. CAD is India as well as in UAE and Asian countries is high. Atherosclerosis that begins is a process, is a normal physiological process that starts since childhood. But once it goes to beyond a certain limit, when it becomes create blocks in the arteries of the heart, then it presented with the chest or heart attack symptom. So ischemic heart disease or coronary artery disease, it may be asymptomatic, or it may occur in the form of angina, myocardial infarction, heart failure, or sudden death. As my colleague earlier mentioned, there are multiple factors. Some are modifiable, some are not modifiable. This is the slide which is very important. To discover a coronary artery disease at the time of chest pain or heart attack is the same like you are discovering pregnancy at the time of labor. The treatment modality which are available for the coronary artery disease are either percutaneous transluminal coronary angioplasty or a bypass surgery. My exact talk is the how to go back to your normal lifestyle after you have any cardiac event, whether you need a angioplasty or a cardiac surgery. So World Health Organization has defined once you have any heart problem or heart attack or a bypass surgery, how to rehabilitate the patient. What is cardiac rehabilitation? So development of physical, psychological, vocational, social and educational potential consistent with his or her psychological impairment conducive to the environmental need. It's a bit difficult definition. So in some simple terms, cardiac rehabilitation aims to reverse the limited experiences by patients who have suffered adverse pathophysiological and psychological consequences of cardiac events, or medical supervised program that helps to improve the health and well-being of the people who have a heart element, heart problem or heart surgery. The aims of cardiac rehabilitation or the cardiac patient back to normal, restore self-reliance in daily activity, formal work activity, full-time employment, compatible with his or her working experiences and sheltered workshop. Cardiac rehabilitation is a teamwork. It is not only a cardiac surgeon or cardiologist, it is a teamwork. It needs a family doctor, cardiac surgeon, cardiologist, anesthesiologist, nurses, cardiac nurses, exercise specialists, physical and occupational therapists, nutritionists, psychologists and other mental health specialists. Working with a team is an important part of cardiac rehabilitation. Share your questions and concerns with team that will help you your faster recovery. How cardiac rehabilitation help you after a cardiac event? Recovery, it promotes faster recovery after heart surgery or angioplasty. It guide you how to prevent further episodes of cardiac problems. It addresses your risk factors, control of blood pressure, diabetes, dyslipidemia, overweight as obesity management, and smoking and lack of physical activity. Depression and other emotional health concerns, healthy lifestyle changes, heart healthy diets, physical activity, stress management. Cardiac rehabilitation program should be customized. Every individual doesn't fix in the every program. So it's according to the patient need, you have to customize the cardiac rehabilitation program. If you have coronary bypass surgery, you can also have the block in a carotid arteries, which Dr. Ajay mentioned, this cause a block in the brain vessels which supply the brain, you can have a stroke. Block in the blood flow to the leg veins, you might have problem of walking, claudication. Block in the kidneys vessels, you have renal failure. Once you have cardiac surgery, the healing after surgery, when you first go home from the hospital, you will focus on making steady improvement each day. Your body become like a weather, like a climate. Sometimes you feel good, sometimes you feel down, sometimes you feel very aggressive, sometimes feel very funny sensation. So, I will address all these issues in coming slides. First and foremost, medication. Once you have a bypass surgery or a cardiac intervention, your doctor prescribe you few medicines, which one is for your blood pressure, first for your blood thinner in the form of aspirin, clopidogrel. Second medicine generally is the lipid lowering medicine in the form of statins. If you are a hypertensive, then you will certainly advise on blood pressure controlling medicine, and if you are diabetic, then some diabetic medicines. Eating a healthy diet. This is very important after the bypass surgery or any cardiac event. A healthy healthy diet is the low in cholesterol and saturated in trans fats that can slow or stop building of new plaques or the new conduits throughout your life. I won't go in detail because Dr. Ajay already discussed in detail about the diet. And now second is the physical activity. One of the best for the physical activity is walking. How much walking? Exercise. There are several options are available, but the rule of 4 equivalent to rule of 4 is the best option. 4 kilometers in 40 minutes 4 times a week, gradually to build in 4 weeks time. You should not start 0 days 4 kilometers. Slowly, gradually increase the distance and the time of your walking, and within 4 weeks time you go to 4 kilometers in 40 minutes time. After surgery, you have to stop driving. There are two reasons for stop driving, because first you are off the road from couple of weeks, you are in the hospital, so your reflexes are not that fast. Secondly, your chest bone has been cut, it will take 4 to 6 weeks time to heal. So, that is the only two reasons that you have to not driving for 6 weeks time. Do not cross your legs, because it increases the static pressure. So, when after bypass surgery is 4 to 6 weeks, you should not cross leg or sitting or praying on the floor. Sometimes you feel some soreness or some funny sensation over the stitched line or the where we made a cut. This is quite normal, and within 4 weeks time it will settle down. After bypass surgery, you can certainly come across some of the few symptoms and change in lifestyle, like loss of appetite, sometimes with constipation, swelling or pin needle sensation over the scar or incision site where we take out the grafts, mild back or shoulder pains, tiredness and difficult sleeping. Sometimes you feeling good, upset and having some mood swings. Avoid isometric exercise. After any cardiac event, we generally advise the patient and of patient relatives, don't board the toilet gates, keep it open, and if you are constipated, don't strain. These are the places where the most of the accidents do happen in a cardiac patient. So, it is supervised. If you go for a washroom, it should be supervised, somebody around you. After any cardiac event and after the treatment, if you feel tired, don't force yourself. Better to take rest and consult a doctor why this symptom I am facing. Rest period after bypass surgery or a cardiac intervention, at least you should have a nap after the meal in the daytime. If you are not feeling good for the nap, better to rest and relax. Stair climbing is not contraindicated, but you climb the stairs like a small kid, one step at a time. Don't go alternative steps. Generally, we take out the veins from the legs. So, first few weeks you need to wear the elastic stockings that will help you in the propelling the blood from the veins which you have taken out for the grafts. and this elastic stockings help you for prevention from the swelling over the vein sides. Sometimes you feel a small lump over the chest or in the sternal area. It is a normal process. Within 6 to 8 weeks time, this lump will disappear. These are the frequently asked questions after any bypass surgery. What should I take if I have a fever? What about alcohol, exercise, smoking, sexual activity and risk factors? Smoking, as I mentioned again and again, is a class 1 indication for no liberty for smoking. Neither you smoke yourself, not second hand smoke, like you go to environment, people are smoking and you are inhaling, because second hand smoke has more harmful than smoking yourself. And third is hard smoking. If you go into an area where people are smoking, your clothes get impregnated with the toxins, and when you go home, your kids, your wife, your family also is exposed to the same effect of the smoke. Smoking generally make the artery wall stiff, the arteries where blood flows. So, and even if we do a bypass surgery, you are not curing the disease, you are making an alternative route for your body. Bypass itself, name as said, this make a bypass, you make a new road to the blocked road. So, smoking is very important, that you should not smoke in any way after any cardiac event. Alcohol, be practical. It is very easy to say no alcohol, but people who love alcohol, they do not feel good that doctor said no alcohol. So, I would say alcohol is not a poison, but is neither a medicine. So, be moderate. Then thirdly, sexual activity is a very important factor. Most of the patients, they shy to ask these questions, but it is a normal process. And after 4 to 6 weeks time, sexual activity is a normal activity, and rather you do not feel any uncomfort or not precipitate your cardiac problem once again. As Dr. Arjia already mentioned about the risk factor management, same risk factor here also: diabetes, high blood pressure, smoking, obesity, dyslipidemia, sedentary lifestyle. So, I won't go into again in the same. Now, stress management, I am just touching the stress management for a brief, but Dr. Savita will speak more about the how to manage your stress. This type 1 personality is the very prone who have this mental stress, and it is very easy to say do not take stress, because today's lifestyle, physical world, everybody is a stress. You have to fight day in day out for your survival. But how to get cool down yourself, it is a individual capacity, individual habit, how to take the things lightly, do not stress, put more stress on yourself. The typical heart patient is a keen and ambitious man whose engine always full at full speed. Same, you are eating your lunch within the phone calls. And second is depression. Depression is quite common in this part of the body, because most of the people, they are single, their families back home. So, somehow there is most of people have depression is there. So, take out the depression, yoga and meditation is a very important thing. So, for a living with a healthy heart, there are a few take home messages. Dietary prudence, regular exercises, no smoking, alcohol in moderation if you like to have, and relaxing techniques. These are some relaxing techniques. Take break after every 3 months or 4 months from your stressful daily routines. I do not know which is possible for everybody or not, but it is very important. Walking as usual, and this swasana or yogasana is very important. There is some studies which said yoga and nidra reduces systolic blood pressure by 15 to 20 millimeter mercury and diastolic blood pressure 10 millimeter mercury. This drop in blood pressure lasts for about 12 months if you do regular yoga and meditation, and it reduces symptoms in almost all patients. So, yoga and meditation is a very important thing. If you do 40 minutes yoga per day, that is for yourself, for your body, for your heart, for your brain, everything. So, meditation is a wonderful thing. Thank you very much. And this is a monument in India.